So most people after a hip replacement will recover pretty well within about 6 weeks. The hip is pretty sore for the first 2 weeks while the wound is healing, and then it gradually gets better. By 6 weeks, they're generally feeling a lot better, but it takes till about 12 weeks before they can normally get back to doing the things that they want to do. So the restrictions after a hip replacement really depend on the type of hip replacement you have. And we try to take into account the things that people want to do afterwards to choose the best hip replacement that will suit their lifestyle. But generally, bending a hip up more than a right angle to the body increases the risk of dislocation. But you can reduce that by using larger headed hip replacements or doing a variety of different techniques. But generally, most patients can do the things that they want to do after a hip replacement. So after a hip replacement, you have to be careful crossing your legs or bending your hip right up beyond a right angle, as this increases the risk of dislocation. But a variety of different types of hip replacements can try to reduce that risk. Yes, so patients want to get back to sports after having a hip replacement. This is generally a very good thing because it helps to strengthen the muscles around the hip. I'm a firm believer that we do joint replacements to give people back the quality of life they want, and therefore it's important that we encourage them to do that and also to get the right type of hip replacement to them to allow them to do that. It's important, however, that some activities that have a high risk of dislocation should be avoided, and sports where you have to do a lot of lunging, particularly a standard hip replacement, can be difficult to do afterwards. But again, there's a variety of different hip replacements that can do that. And look, Andy Murray's back playing tennis at a top level after having a hip replacement. So the first thing that I would advise after a patient has just had a hip replacement is that you need to be careful of it. The first 12 weeks are very important to allow the ligaments to heal. And if we try to do too much too quickly, then that runs a risk of those ligaments not healing, which can increase the risk of it dislocating in the future. So I think it's really important to follow the physiotherapist's advice. I think it's very important that you're aware of your healing, and if you have any problems with wound healing, any discharge from the wound, any redness, that you contact your surgeon quickly to make sure there are no problems with the recovery.